Bismillah ar-Rahman ar-Rahim. Now I'm taking on the serial of lectures on infection and the disease. Now this is my third session with you. I am Professor Asad Yadar and I am representing as a visiting faculty of medicine at GSMU Karachi. Now today's topic actually is important parameters and terminologies we use in cases of infectiology or infectious diseases or infectious patients. You know what is an infection, first of all. Infection is the entrance of some microbiological agent inside the body and its tendency to produce the specific pattern of illness. This is infection. Infectious means that the part one person can communicate the disease to the other. All infections are not infectious. Some infections are not infectious. Majority of the infections are infectious or infective. And there is a very marvelous system in the body created by the Almighty Allah to combat this illness from this infection. Now this is beautifully elaborated in the Garden Medicine of Physiology, a book of physiology and medicine, in Samson Wright and the other books as well. What happened if some of the infection or some of the noxious products try to enter into the body? It is written very, very beautifully and very easily written to understand in the textbook of physiology. I am just repeating few words from it, and it covers actually in 7 or 8 chapters of Garden the physiological response against this infection. The first line of defense is the coverings. Remember, the coverings in the body. Skin is the first protective agent. For example, mucous membrane. And these are the related structures in the body, the linings. These are the first line of defense. Mucous membranes, the serosas, serous membrane, peritoneum, parietal peritoneum, visceral peritoneum, I think the same plural, the parietal and the visceral, and the meninges and synovial membranes. Now they have got defensive mechanisms. Mechanical defense. Pericardium is the extreme example of anything, beautifully designed by the Almighty. There is a fibrous pericardium, there is a visceral pericardium, in which there are 2 layers, the parietal pericardium and the visceral pericardium. And overall, there is a thin layer of fluid inside that is called pericardial fluid or peritoneal fluid or the pleural fluid. These are the barriers against this entry of anything. Beautifully designed. The first line of defense. The second line of defense is when the body tries to enter into the body. And first line of defense also compromises the secreting antibodies, IgA antibodies, mucous membrane, nasal mucosa, for example, and others also. In the GI tract also, there are IgE antibodies, which are protective, humoral type of the nature of the antibodies, and some are specific and some are non-specific. They are acting on the noxious agent. If the agent is not killed by this, the second line of defense comes into action. That is the reticuloendothelial system in the body. This is most active system. That is, lymph nodes and lymphoreticular systems are in the body. In this fashion, the modified lymph nodes like spleen and adenoids and tonsils and appendix, although appendix is a vestigial organ according to many of the physiologists or pathologists, but I do not concern about it. I don't want to comment in this, but this is which I achieved from my experience of the life, is that nothing is waste from nature. It is not vestigial. Penile body was vestigial at one time, but now it is not a vestigial. He said it is a supreme commander of the endocrine system. It is the master gland on the pituitary, hypothalamus pituitary system. And this is the theory. Now it is proved that there are certain hormones are releasing from it. As the research going on and on and on, it will come now. This is the second line of defense. In this defense mechanism, there are lymphoreticular systems are operating, and mostly they are derived from the lymphocytes series. And they are active against these and try to limit there. Thereby, that's why if there is inflammation in the mouth, there will be a reactive lymphadenopathy in the retromandibular area on anterior cervical nodes, for example. For inguinal lymph nodes, if some infection occurs in the node, in the toe, this is the second line of defense. It will try to stop the hair in the lymph nodes. Now this is the second line of defense created by the nature. If the agent is able to enter into the body via blood, hematogenous, and try to locate in the systems, then the system operative are two types. Either the cellular type of the immunity will generate, or rather the humoral type of the immunity will generate. They will defense against this infection. And that's why the body, against these external noxious agents, in a low dose will produce the immunity against it. The extreme example of it, again I will say, is that in Afghanistan and those people who are called, they are coming from Afghanistan, from Afghanistan and Pakistan, and they are settled there. You see in Karachi there are a lot of people belonging to Afghanistan, and they are picking the, what we call the debris, and very noxious type of places they are visiting, just to pick something, and they earn like this. Not a single person of Afghanistan acquired the coronavirus infection. In my studies, 850 patients I have taken from different units, but nobody was affected against the corona. Why? Because the acquired immunity they have developed. There are two types of immunity: innate immunity, inborn, and second type of immunity is the acquired immunity. The acquired immunity was gained by these people, and they are usually healthy people. They are moving here and they are eating everything. They don't know what is, and they actually grace the God that they can engulf anything, and they can be protected by any noxious agent. they have other problems. But the thing is, I'm telling about something about infection is concerned. They are very resistant against these infections. A small amount of the material is going inside and they are developing the resistance against this infection. The third type of defense, it means that there is cellular type of immunity or the humoral immunity. It may be innate immunity or inborn immunity, or it may be acquired immunity. Cellular immunity means that cellular level lymphocytes, the monocytes, you have seen it, eosinophils, etc. They fight against this. And they are converting into the macrophages, giant cells, whatever it is. Tissue level histiocytes. The humoral immunity is concerned, the antibodies, full immunoglobulins, IgA, IgG, IgM, IgE, etc., IgD, a long chain of immunoglobulins. They bind the agent and kill through many systems are operating in the body. And this is which is the introduction of the important parameters and terminologies in infectious patients. For example, some patient has got the three type of these defense powers. Some of the walls of these are the walls against infection, are weak. Then the disease process starts. The agent may be a notorious agent, it may be possible. It may be a mutated type of a agent. It may be very invasive type of a agent which can enter and can fight. This is the fight between the immune system and the agent which are entering into the body. If our defense mechanisms are highly operative, then there will be nothing will happen. But if the system of defense is weak, of one wall, the first line, then second wall, second line of defense, and third wall, which I have just told you about the immune mechanisms, then that agent is able to survive and can produce the specific symptomatology or clinical picture. So this is a fight going on day by day from the birth to the death. Now these are the terminologies if the agent is able, for example, to enter into the body and produce the disease. These are the terminologies. The one terminology is transient bacteremia or bacteremia, pyemia, septicemia, systemic inflammatory response syndrome, sepsis, sepsis syndrome, septic shock, post-sepsis syndrome, refractory septic shock, MODS, multiple organ dysfunction syndrome, or erythrophagocytic syndrome. In between, you can add one thing more, that is disseminated intravascular coagulation, which is the result of these problems here and something here. To understand this terminology, the ideal example is given by Walter Israel is salmonella, typhi. Salmonella typhi can produce anything. It is the extreme of an example which is written in the, and beautifully written. I will say I have never seen an article like this, which is written in the Journal Pathology in Walter and Israel. That is one of the best written to understand these terminologies. Because everybody does not learn these things. Everybody is dependent on the internet. Most of us are dependent on the lectures or the shortcuts of life, of the study. They cannot describe. For example, in 90% of clinicians, I challenge them, describe these terminologies. They can't describe. Why they are described? Because they have not taught like this, which I am teaching now. Transient bacteremia means that the first defense is gone, the second defense is gone, and the bacteria was able to come inside, or microbiological agent has entered into the body. And the third system is fighting now to kill these bacteria or microbiological agent, and the disease does not produce because of the third defense mechanism is there in the body, and it defends very nicely. It is transient, 1 day, 2 days, they are fighting each other. War is a war. The war will take time. It may be 1 day, it may be 1 hour, it may be 2 days. Patient is asymptomatic in this condition. First terminology is transient bacteremia. Now, transient bacteremia is usually symptomatic, and thus the little clinical symptoms. Most patients, individuals with valvular heart disease, they are notable exception only. The disease valve, a small amount of the bacteria, it depends upon the quantity of the bacteria. The quantity of the bacteria, although very small, and the fighting is going on. Because of this, circulating bacteria may lodged or damaged on the damaged prostatic heart valves, resulting in the bacterial endocarditis. This is possible. If you are manipulating for example, the mouth by surgery or by a dental surgeon, the transient bacteremia in the disease valves will be very, very important. Because this transient bacteremia is now enough to launch or to settle down on these damaged heart and can produce what is called endarteritis or endocarditis. Transient, usually asymptomatic bacteremia occurs in a wide variety of procedures and manipulation, for example, in the lower urinary tract, for example, or from upper you will get the bronchoscopy and other things, resulting with the mucous membrane trauma means that this defense is gone, and third defense is operating now. And third defense was not able to tackle it out. It may also occur with such daily functions as toothbrushing and the bowel movements, which is going on. Wearing, tearing is actually a part of the life, and bacteria enters into it as a transient bacteremia. Toothbrushing will cause the transient bacteremia. The prostatic examination per digital can cause the movement of the bacteria from the prostate into the blood. Although it is transient, the transient means that the quantity of the bacteria are not enough to produce disease. So this is a transient bacteria. But in those cases where there is a diseased heart valves or heart or arteries or other, there are other examples as well, where the diseased or rather the damaged organ was there. They are able, very, very small number can cause the pathological process and can cause the disease. Now the third one is the bacteremia. The bacteremia, when say the quantity is increased now. The fighting between the number of the microbiological agent of bacteria are more enough than your fighting weapons. So they overcome on the fighting weapons, and this is the presence of bacteria in the blood in a large quantity. It may be a large one. It can occur spontaneously due to certain tissue infection with the use of the indwelling catheters, IV, genitourinary or dental or the gastrointestinal genitourinary wound care. Bacteremia is the quantity of the bacteria more is enough to compel against the third line of defense. And this is the end of the what we call as the incubation period, and the patient can present, for example, a clinical scenario like fever. It's going on in your life many times, bacteremia. And then in the quantity, these bacteria, they are picked up by the reticuloendocrine system. There is hyperplasia of the reticuloendocrine system or lymph nodes, for example. And in the cells of these reticuloendocrine system, they are now under these cells, they are protected now. They multiply, secreting many enzymes to kill the weapons which are present already inside the reticular system, and they are not able to kill these. And rather, a wall is created. Inside this wall, the bacteria are multiplying, and gush of the bacteria now enter into the blood. It is the quantitative definition, it is not a qualitative definition. Now, septicemia means that the enormous amount of the bacteria spread and the toxins in the bloodstream. Now, it's called the blood poisoning of toxemia. This is the case of toxemia. Toxins, exotoxins, endotoxins, they are releasing from the bacteria, as well as number are increasing. Now, if these are much more, so much that they can cause aggregation, sort of embolism, and this is called pyemia. It means the pus containing small particles are there. A form of the blood poisoning that is called by the presence of the blood, pus-producing microorganisms, they are carried to the various parts of the body, producing multiple abscesses. Pyemia occurs, of course. I already said it is beautifully written as a novel example given in the enteric group of fevers. There is present bacteremia, and then there will be a bacteremia, and then there will be septicemia. Septicemia checked by your, definitely the third defense is going on, it's fighting against. It failed, then it goes into the pyemia. It is the correct time when the bacteremia, and between the bacteremia and septicemia, you will interfere and kill them by antimicrobial agent. Otherwise, it will turn out to be a pyemia. So pyemia means that this distant organ, it is metastatic type of the septic emboli, you can see. Metastatic septic embolism is pyemia. This should be very clear, that is this terminology. And then this is what is called as now the body third defense mechanism. Every defense mechanism inside your milieu interior now is activated. And this is called the systemic inflammatory response syndrome. Now, this is the last stage in which you can do something to this patient. Otherwise, it will go into the other problems. You will see what happened then. 4 SIRS criteria were identified: the tachycardia, heart rate 90 beats per minute. It may be bradycardia also. Tachypnea, respiratory 20 beats per minute. It may be rather the hypoapnea. It may be possibility. It may be fever or hypothermia, both can occur. It may be leukocytosis or it may be leukopenia. I think there are two है, या तो स्टीम है या फिर उसका लोअर डाउन है, दोनों चीज़ें सिर्फ पॉसिबल हो सकती हैं. And anemia, that is white cells, is more than 1,200 per cubic millimeter, leukopenia. Very low leukocyte count, less than 4,000 per cubic millimeter. Anemia means more than 10%. The white blood cell usually between 1,200 to less than 4,000. Actually, you know the leukocytosis, though I have already said mild, moderate or severe, I have already discussed before. And leukemia reactions. These are all the, response of the WBC series is concerned. And again, the differential is concerned whether the neutrophil will be active, or the lymphocyte will be active, or the monocyte will be active, or the eosinophil will be active. The fourth, sixth criteria should be identified. If the patient is tachycardic, they have documented fever, for example. He has got the tachypnea. He has got the lab evidence of leukocytosis. It means that he has now go into this systemic inflammatory response syndrome, and you can help this patient to come out from it, because it will go into another stage of the disease that is called sepsis. Now, sepsis is the condition in which there is a microbiological proof of the infection in the body or in the blood. So blood culture or other cultures will identify that sepsis is there or not. If there is no proof, you will not use this terminology. You will stick to the terminology of systemic inflammatory response syndrome, extreme response to the infection. Life-threatening medical emergency, if it occurs, it means that a lot of bacteria inside your body, culture and sensitivity can be done here, and a specific antimicrobial agent will be helpful to fight against this infection. The pulmonary sepsis, for example, uro sepsis or GI sepsis or dermosepsis, etc., are identified terminologies we see in our clinical settings. Basically, there will be a condition that you should demonstrate it by the lab, by the microbiologist, that he has been infected. अगर ये आप नहीं बोलेंगे तो sepsis को prove नहीं कर सकते. Clinically तो बोलेंगे सिर से probably ये sepsis में जा रहा है. It's possible like this. Sepsis is a terminology in which you have to demonstrate it. इससे आप नहीं निकाल सके तो फिर that is a shock. Their vicious cycle starts, and the body highly reactive against this, as fast heart rate, tachycardia, fever or hypothermia, shaking chills, warm, clammy, sweaty skin, hypertension, confusion, deterioration, hyperventilation. So, if the condition is associated with the severe hypertension, that is called shocked state. Shock occurs because of the septicemia or SIRS. This is called septic shock. Now, post-sepsis, sepsis has been achieved, and you have tried to fight against this. Now, this is the cycle. Every system is not operating. New infections. The sepsis at that time is gone, according to you, but new infection prone to develop, recurrent infection prone to develop, cardiovascular disease because it will cause by the direct injury to the myocardium or by the autoimmune mechanism, changing in the protein metabolism, there will be inflammation. There is immune dysfunction. यानी ये कह रहे कि मरा तो मर गया, मरने के बाद भी उसने आपको नहीं छोड़ा. इम्यून डिस्फंक्शन डिस्टर्ब कर दिया उसने. Abnormal function, this is. Abnormal, I will say, immune system. And this will cause the fluid retention in the body because of the hormonal effects are disturbed and the cognitive changes in the brain. Recurrent infection, new infection, again this is the cycle which is going on. The post-sepsis syndrome, that is called. Not all patients develop this condition. They said about 5 to 10% of the patients, they develop this condition although there will be no evidence of infection, according to the microbiologist, blood pressure is negative, the urine is negative, sputum, everything was negative. Another condition, terminology we use is the multiple organ dysfunction syndrome. If now this is a septicemia is going on in this patient, and those patients can be defined as the development of the potentially reversible physiological derangement by involving the two or more systems not involved in the disorder. Usually they are not prone to develop. Usually, coronarity they are, have got affinity towards the lungs. But coronarity can involve the liver, can involve the kidneys, can involve the brain. This is an example of coronarity because it is a hot topic. Although it is very, very, identified modes in cases of the what is we called as enteric fever. We see MODs many times in life. If there are two or more organic systems are involved, it is called MODs. And the patient should be aggressively managed in the ICU or HDU and arising in the wake of the potentially life-threatening physiological insult. The last warnings means एक warning है आपके पास. These are the last warnings. Do something, do something, do something. Another terminology we use here is the hemophagocytic syndrome. Now this is the terminology which means that the end of the life. If the erythrocytes, which are this function, to carry the hemoglobin, oxygen to the distant part of the body, according to the criteria they develop, there is a society actually which is dealing with these infections. It's called the hemophagocytic lymphohistiocytosis. Actually, histiocytes, the lymphocytes, and the phagocytes, they engulf the RBC. And you can demonstrate in the blood or you can demonstrate in the bone marrow. If you demonstrate this type of a phenomenon, this is called hemophagocytic syndrome. It comprises the fever, then splenomegaly, or it may be bicytopenia. For example, there is thrombocytopenia along with the anemia, or there will be a leukopenia with thrombocytopenia, for example, or hemophagocytosis. This is the terminology which I am saying. Hemophagocytosis. They are the macrophages in the blood or in the bone marrow or reticulum in the system. They engulf the RBC. खुद ही वो खा गया, ऑटोफेगी जिसे कहते हैं, अपनी ही चीज़ को वो खा रहा है, engulfing its own constituents, and it leads to the acute physician that the ferritin levels are much higher. You cannot imagine 2,000, 3,000, and elevated soluble CD25. If you can do this parameter, it is very good. Otherwise, it is not available everywhere. If some person has got the fever and splenomegaly, bicytopenia, or lower platelets, and you have seen one or two in the blood smear or in the marrow smear, the hemophagocytosis, and it is supported by the high ferritin levels, it means that the hemophagocytic syndrome has been occurred. It means that you are very near to the end of your life. This is the last thing, not the least, in the process of cascade, I will say, of the infection which is produced in the body. So these are the terminologies I have used it to understand by you very carefully that in between these terminologies, one terminology is missing, which is initiated by the septicemia, or by the SIFs, or by the sepsis, or by the septic shock, or by the omnibus, whatever it is. That is called the disseminated intravascular coagulation. Now, in the coronavirus infection, all are seen. DIC is also a part of and resulting ending as ARDS. A system in lung is involved in MODS is there as ARDS, and the patient dies. Most of the mortality occurs in the coronavirus infection because of the DIC and because of the MODS. Specifically speaking, the ARDS, acute respiratory distress syndrome, means that respiratory type 2 failure. And the people don't come out from the ventilator. Why? Because the other system are also involving. The heart is involved, the lungs are involved, the kidneys are involved. Because the virus is so much mutated, a most powerful virus, very, very invasive virus is there. There are a lot of examples of other invasive viruses as well. I was just quoting the coronavirus on the viral side and the salmonella on the bacterial side. Fungus will cause the same problem. Rickettsia can cause the same problem. Schiraldia can cause the same problem. Spirochetes will cause the same problem. Even parasites can cause the same problem. Some parasites can cause the syndrome like this. They are blood-borne parasites, you know that, and they will act like this. Uski terminology will change, transient parasitemia or phala. Whatever you want to write is okay, fine. The thing is this is the process which is going on in your body, and defense mechanisms have been discussed now with you, and you should remember this lecture or tutorial or advice which I have given to you. Please remember in your life. If you can understand these terminologies, you can easily manage the infection. You can understand the infectious diseases very well. I'm very thankful to you have listened it. Wama alayna illa al-balagh. Assalamu alaikum wa rahmatullahi wa barakatuh.